Today, we're going to take a closer look at what happens on the day of hip surgery and recovery. Meet Margaret, who arrived at the hospital feeling a mixture of nervousness and anticipation. Before the surgery, Margaret met with the surgical team, who reviewed the treatment plan with her and reconfirmed her consent. This is a crucial step to ensure patient safety. During the surgery, the team worked meticulously, following the carefully planned procedure. The surgeon skillfully removed the worn-out ball portion of the joint and prepared the surface of the hip bone for the artificial replacement. After the surgery, Margaret followed an enhanced recovery protocol designed to help patients regain function more quickly. This included gentle physiotherapy exercises and pain management strategies. Margaret's recovery was challenging, but she remained determined. Each day, she noticed improvements, from being able to sit up in bed without help to taking her first steps with a walker. Margaret's journey to full recovery would take several more weeks, but she was well on her way. The enhanced recovery protocol, combined with her determination, had given her a new lease on life. Don't forget to subscribe and like.